Namaskaram to all of y'all. Okay, just like the previous lectures on thyroid hormones and candidiasis, magnesium is another lecture that I thoroughly enjoy always. It's very close to my heart. At the end of this lecture, I'm sure all of y'all will realize that good health, or if not good health, living itself is not possible without magnesium. And if one is deficient in magnesium, he or she is likely to suffer a host of medical problems. Unfortunately, again, such an important topic and a mineral is hardly addressed in conventional medicine. So the reason why I encourage you all, especially the public, to join is because you can take care of your health and you can always discuss what you know with a doctor who is not aware or someone who has been trained in integrative medicine. Okay. Now, deficiency, as you will see along the lecture, that deficiency of magnesium not only affects health, but it affects your aging. And one significant way or important way how it affects aging is because I've mentioned this before. We are just electrical beings. We are just energy beings. And when you have deficiency in cellular energy called ATP, every cellular function suffers, and that leads to premature aging and disease. So magnesium is very important. So why do I say this is a very important topic is because of these facts. Number one, it is the most abundant mineral in the body. And it is used in more than 800 physiological functions inside the body. And sometimes you wonder, wow, how can one mineral do so many functions? It's easy to understand this if we know that inside the cell itself, there are about 75,000 enzymes. And magnesium is responsible for at least 800 of them. One mineral helping in 800 reactions, enzymatic reactions. So that's how critical this mineral is. But the sad thing is, of course, deficiency is extremely common, extremely common. So it's one of the more commonest deficiencies in the body, and almost every disease can be associated with magnesium deficiency. So I call it the master mineral or wonder mineral because it is very important for blood circulation. It is important for blood pressure control, for better sugar balance, cellular energy production. So everything that happens in your body, your heart beating, heartbeat, your brain function, if you want to think and you want to remember, you want to exercise, you want to digest your food, you want your immune system to function, everything depends on this cellular energy called ATP. And very often it is not recognized that we only talk about ATP from mitochondria, but we don't realize that ATP itself has to combine with 2 atoms of magnesium for it to become active. So ATP without magnesium is actually an inactive ATP. So even if your mitochondria produces ATP, if you are deficient in magnesium, it goes to say that your cellular energy will still be deficient. So it promotes calmness of both the body and the brain, and it helps in pain control. 65% of magnesium is in the bones and teeth, and about 35 to 40% is in the rest of the body. Blood contains just 1%. Why is this important to understand? Because doing serum magnesium is not an accurate way of assessing the body's magnesium levels. Highest tissue concentrations are in the heart and brain cells, just like any other organs. Any organ that works 24 hours, including your lungs, your brain, your heart. They all need a lot of energy, and that's where magnesium is also heavily concentrated. So from the previous two slides, you will now understand that deficiency can cause many diseases. All muscle cells, including heart, contains more magnesium than calcium. Please remember this. The biggest mistake that patients and doctors make is to give regular or routine calcium supplementation, which in my opinion is wrong and dangerous. I'll show you some slides where you will understand that why extra calcium in the body in the presence of magnesium deficiency is dangerous. Okay, and if someone complains of muscle weakness besides the hormones, remember magnesium deficiency and vitamin D deficiency are common reasons for muscle weakness. So this is a big problem in aging people. Deficiency also plays a major role in arterial calcification. Now, arterial calcification or kidney stones, calcium kidney stones, or you have spurs on your heel, or you have osteophytes, spondylosis. These are all signs of calcification outside the bone. And I've mentioned this before. So calcification of your arteries is also a calcification outside the bone. And this is due to deficiency of magnesium, vitamin K, especially K2, and vitamin D3. So if you get arterial calcification, then you are deficient in magnesium. So someone who has atherosclerosis and a blocked vessel, undergoing stenting or other procedures, it's okay as an emergency procedure if you get chest pain and you want to prevent a myocardial infarct. But that itself does not solve the underlying problem, because we are just looking at arterial calcification in the heart vessels, but arterial calcification is actually systemic. So if you have it in the heart, you are very likely to have it in the kidneys and elsewhere as well. Now, magnesium is also the building block of life. Both your RNA and DNA need both ATP and magnesium to maintain stable genes. Why is this important? Because if your genes become unstable, then they are likely to undergo mutation, and mutated genes not only give rise to cancer, they can also give rise to other problems. And magnesium is required as a cofactor for DNA polymerase that creates DNA molecules for DNA replication. What it simply means is magnesium is necessary for dividing cells to inherit the DNA from the parent cells. So for effective cellular division and DNA replication, you need magnesium. Both calcium and magnesium are needed for optimum cellular function, but much more magnesium is necessary than calcium. And magnesium deficiency is extremely common, unlike calcium deficiency. Calcium is easily obtained from food. Magnesium is difficult, okay? And magnesium entry into the cells need vitamin B1 and B6. So this is why it's important to take a combination of supplements that gives you supply you the other vitamins and minerals as well. Selenium is another very important hormone, not only for immune system and thyroid function. It helps in magnesium retention in the cells. Zinc helps in magnesium absorption. And magnesium works with vitamin D, A, and K, along with boron and zinc for bone health. Now, I'm sure you would have come across your friends or family members have been prescribed with high dose magnesium to treat osteoporosis. It is not the correct treatment. Osteoporosis needs more magnesium and not calcium. And osteoporosis needs hormones, especially testosterone and estradiol. Osteoporotic bones need vitamin D and K, as well as other minerals. So just taking calcium will only worsen the situation. So remember, osteoporosis is a combination of deficiencies of hormones, vitamins, and minerals. So the other nutrients, how do they affect magnesium function and absorption? Boron is necessary for magnesium and calcium metabolism. So you have seen zinc, you have seen boron. All these are also necessary. Vitamins B, B vitamins, especially B1, B6 are necessary. Magnesium deficiency exacerbates vitamin K deficiency, which means it's a double whammy for atherosclerosis, because K deficiency itself increases the risk of atherosclerosis. And if you are deficient in magnesium, it just worsens the situation. Magnesium, along with iodine, selenium, zinc, and boron, support thyroid function. From my previous lecture on thyroid hormones, you would have realized that this is hypothyroidism is extremely common, including in children and adolescents. So remember, if somebody is hypothyroid, it's likely to be also associated with magnesium deficiency. Now, association with other nutrients, low potassium levels increase magnesium excretion. This is why you should routinely look at your potassium levels. If you do a renal profile, besides sodium and chloride, potassium also will be checked. But potassium should be at the upper limit of the reference range. Okay. Magnesium should be at the upper limit of the reference range. Calcium must be at the lower limit. Please remember this. High protein diet is not good, because there are patients who do a keto diet. I had a patient who was on keto diet and she could never solve her medical problems because she was advised to take a lot of protein. So you should take a modified keto diet. High protein diet is a problem for magnesium as well. Now, because more magnesium is needed for digestion, so you become magnesium deficient. Decreases magnesium absorption. So when you're on high protein diet, you decrease magnesium absorption. Now, besides that, a high protein diet is acidic to the body. So what happens when your body becomes acidic is, it will remove minerals from the bones to alkalize the blood and the cells. So what minerals does it remove from the bones? Especially magnesium. So in order to save your life, body will adjust the pH by bringing it back to the alkaline pH by depleting minerals from your bone. So high protein diet can actually cause magnesium deficiency as well as osteoporosis, besides being acidic. Stress increases magnesium loss. Trans fatty acids, high omega-6 diets is a problem, not only for magnesium, for many other nutrients, because they make your cell membranes rigid. Now, sadly, this is not recognized. This patient I was telling you about, who was on keto diet, on a high protein diet. Now, she started taking virgin coconut oil, and cholesterol apparently went up. And I don't believe it is because of coconut oil. It could be many other reasons. So her cardiologist asked her to stop coconut oil and switch to an oil that she buys from supermarket called Natural, which is available here. This is high in omega-6. And these oils are kept in large plastic bottles that have a long shelf life because they undergo heat treatment. So, and they are called hydrogenated oils, hydrogenated fatty acids. So because They are heated to a very high temperature and a hydrogen molecule is added to the oil. Otherwise, water and oil do not mix. Why do they do this? Is because to prolong the shelf life. So these oils are actually dangerous. So there are many wrong advices out there about oil, but generally good oils will be virgin coconut oil or olive oil. But oils of food high in omega-6 will cause membrane rigidity. So you'll have a lot of problems. You will not be able to absorb nutrients like magnesium. Even your insulin won't be functioning well. Now, some points about magnesium and calcium is very important to understand. Magnesium is 10,000 times more concentrated than calcium inside the cell. So that makes magnesium supplementation much more important than calcium. And magnesium is a natural calcium antagonist. You don't need a calcium channel blocker drug. You can just use magnesium. Calcium channel blockers are used for heart conditions and high blood pressure. Okay. Natural calcium channel blocker. So magnesium does everything that a calcium channel blocker does. But the point to remember is you have much more magnesium inside your cell than calcium. So don't go on supplementing yourself with calcium or drinking dairy products to increase your calcium levels or taking soy products to increase your calcium level. So what was our ancestors' diet was like? Calcium magnesium ratio was 1:1. This was ancestors' diet, maybe our forefathers. Now the current diet, sadly, calcium to magnesium is from 5:1 up to 15:1. So you can realize that modern diet causes widespread magnesium deficiency. So this is a healthy cell on my left. A healthy cell will have a lot more magnesium compared to unhealthy cell that has a lot more calcium. But when you are magnesium deficient, you will have calcium excess inside the cell, even if you don't take calcium supplementation. The reason is because you need a lot of magnesium inside the cell to drive the calcium out and just maintain what is necessary for healthy cellular function. So if you are deficient in magnesium, you are likely to accumulate calcium inside the cell. And I'll show you in some slides, I think the next few slides, why excess calcium inside the cell is dangerous. Increased intracellular calcium causes intracellular oxidative stress. Okay. Now, we know that oxidative stress releases a lot of inflammatory molecules and releases a lot of free radicals. And that is one of the underlying causes for almost all known diseases. But where do you think the problem starts? It starts primarily from the cell itself. So anything that causes intracellular oxidative stress will increase your risk of almost all the diseases. So what causes increased oxidative stress inside the cell? One is excessive carbohydrate consumption. When you burn carbohydrate for energy, it releases a lot of free radicals. The other is having too much calcium. So again, a reminder, do not take calcium as a supplement unless you are suffering from osteoporosis and low levels of calcium, and you take calcium together with a higher dose of magnesium, other minerals, along with vitamin D and K2 and testosterone. Okay. So the way to reduce calcium levels is to increase the magnesium. So if there are patients who have regular infusions of magnesium and other vitamins, so those patients who have higher levels of calcium, it is good to increase the magnesium intake and repeat the calcium levels. If it is still high, then infusion, it's slow intravenous magnesium or magnesium infusions will help, and you can monitor and notice that the calcium levels come down. Always look at the calcium level, and that should be at the lower end, and some labs will give you more accurate value. So they'll give you the total calcium and corrected calcium. And as far as calcium metabolism is concerned, there are 3 hormones that are involved. One is the parathyroid hormone, the other is calcitonin and vitamin D. All the 3 hormones require magnesium for the activation and regulation. So for calcium metabolism itself, you need magnesium. A mention of hyperparathyroidism. Now, many of you may not have heard about this. Parathyroid glands are just behind our thyroid gland. There are 4 small glands at the back of your thyroid gland. Unfortunately, when you have thyroidectomy, where you remove the thyroid gland, most of us lose our parathyroid gland as well. So it disrupts or dysregulates the calcium metabolism, because parathyroid hormone controls calcium levels in the blood. So if calcium level is low, parathyroid hormone will be high to take the calcium out of the bones and put it into your system. Once the calcium levels go up, parathyroid hormone will normalize. This is how it is regulated. But sometimes the problem is you can have higher levels of parathyroid hormone, which is called hyperparathyroidism, just like hyperthyroidism. So this means increased parathyroid hormones. It is not uncommon. It is relatively common. It's in about 1 in 100 people. But usually they are benign adenomas. They are not malignant. The problem is, if you do not recognize this, how do you recognize this? You can always routinely check your parathyroid hormones. If you can't afford, at least look at calcium levels. If your calcium levels are high, then the usual reason is high parathyroid hormone levels. So it's good to check as a routine. So parathyroid hormone, hyperparathyroidism, increases calcium levels, and it leads to systemic calcification, which means calcification of your blood vessels, calcification in the kidneys, calcification in the breast, calcification in muscles, and so on. Okay, so I'll show you in one of the slides. It's good to let you know now itself. Women who have breast calcification are often scared about breast cancer. But remember, whenever you have calcification outside the bone, I've already mentioned the causes. It is vitamin D, vitamin K, magnesium deficiency, and probably a higher level of parathyroid hormones. And this hyperparathyroid hormone could be because of low levels of magnesium, vitamin D, and K2. Why is this important is, if high levels of parathyroid hormone associated with high calcium levels are detected, the common advice would be surgery to remove your parathyroid hormones. But before doing that, you should actually look at your magnesium, vitamin D, and K2 supplementation. You can check this. K2 is a bit difficult to check, but magnesium and vitamin D are easily available as lab investigations. You should check, and if you are deficient, which is more likely to be, correct them, because when you are magnesium deficient, we have already mentioned that it disturbs hormonal function. When you are vitamin D deficient, your calcium absorption will be low. So your blood will detect, your body will detect low levels of calcium, and it will automatically increase your parathyroid hormones. And parathyroid hormones will leach the calcium from the bones and put it into your system. And that causes high levels of calcium. High levels of calcium again causes systemic calcification and a host of problems. Okay. Hyperparathyroidism in return also causes magnesium deficiency. And hyperparathyroidism, when you have high levels of parathyroid hormone, it is usually associated with headaches, kidney stones, which I just mentioned because of systemic calcification, osteoporosis, I just mentioned. It can also cause hypertension and palpitation. Now, the hypertension with hyperparathyroidism is especially labile, which means that the blood pressure suddenly shoots up and then it comes down. Then during the sleep, it suddenly goes up again. So we call it labile hypertension. So which is important to recognize. And it can also cause depression. Now, all these are also typical signs of magnesium deficiency. Again, it goes to point that if you have hyperparathyroidism and the usual diagnosis is enlarged parathyroid glands, and the usual advice is a surgical treatment, my advice is look for deficiencies in magnesium, vitamin D, and vitamin K, correct them because they will normalize the calcium levels and the parathyroid hormones then can be normalized. Low levels of magnesium elevate parathyroid hormones, as I mentioned. Now, magnesium is necessary for absorption, just like vitamin D, for absorption and metabolism of calcium. Magnesium stimulates the production of calcitonin. Calcitonin actually just works the opposite of parathyroid hormone. Magnesium suppresses PTH, which is the parathyroid hormone, when it is elevated and prevents osteoporosis. Magnesium also activates vitamin D to increase calcium levels and reduce parathyroid hormone. So basically what it means is you need magnesium for better control of parathyroid hormone. So you need magnesium for better control of calcium levels. If your calcium levels are low, let me repeat, if the calcium levels are low, your body will increase the parathyroid hormone to take the calcium out of the bones and put it into your blood so that the body will be happy. And then the parathyroid hormone will come down. But this itself is caused by magnesium deficiency primarily, which affects the parathyroid gland indirectly. So don't rush into a surgery, although you will want to look at your parathyroid hormones, especially those who have hypertension and those who have high levels of calcium. So this is some of the ratios you can see, calcium to magnesium. Most of natural foods, if you look, there is either the same amount or more magnesium. Whereas milk has got a lot of calcium, yogurt has got a lot of calcium, calcium fortified orange juice is a disaster, and antacids, which is often taken for gastric problems, which I explained in my candidiasis lecture previously, that it is not the treatment. Okay. Calcium supplementation and the risk. Excess calcium increases the risk of not only heart disease because of atherosclerosis and stroke, but increases arthritis, poor kidney functions, kidney stones, and osteoporosis. Increased calcium causes increased intracellular oxidative stress, which I just mentioned. Now, another big problem is not only systemic calcification, but excess calcium can also calcify your mitochondria. Mitochondria is the basis of life and energy. It also increases the risk of macular degeneration and blindness. Why I'm showing some slides on calcium in a magnesium lecture is, now I want you to think twice before you routinely supplement yourself with calcium. You walk into a pharmacy, it's always about calcium. You walk into orthopedic clinic, it's always about calcium, but it has to be about magnesium. So what I mentioned earlier is calcification outside the bone is known as non-osseous calcification. It can also reduce the intestinal peristalsis affecting your bowel movements and digestion. It can combine with phosphorus or oxalic acid to cause kidney stones. So magnesium deficiency causes kidney stones. When you have excess calcium in the presence of phosphorus or oxalic acid, it causes kidney stones. And kidney stones are not caused by vitamin C intake. Many of you keep asking, if I take a lot of vitamin C, does it lead to kidney stones? It is not. The brain also can be a problem for excess calcium, causing dementia and Alzheimer's disease, etc. Cell membranes can be calcified, disrupting cell function, which means what you need to absorb as nutrients, what you need to detoxify the cellular garbage, you will not be able to do. And it affects the receptors for hormones like insulins and other hormones. So once your cellular membrane becomes rigid and dysfunctional, the cell suffers. Breast tissue calcification. Yeah, this is another reminder. That's why I mentioned earlier. Now, very often, women who undergo mammogram, I usually do not advocate mammogram. All you need to do is regular ultrasound of the breast. Mammogram itself exposes your breast to a high dose of radiation. Imagine it, the plates are directly on your breast. So that's radiation. And if you have a diagnosis of calcification, then immediately there will be a cancer scare. I mentioned earlier that extra bone, calcification outside the bone or non-osseous calcification, you should understand it is nothing to do with calcium itself. It is to do with deficiencies of magnesium, D, and K. So even if you have calcification in a tumor, you should still look at those deficiencies. Magnesium also plays a huge role in vitamin D metabolism, and is important in many steps of the vitamin D metabolism, and it is necessary for intracellular activation, which means you make your own vitamin D or you take the supplements. But once D is inside the cell, it has to be activated, and that needs magnesium. Deficiency of magnesium can cause pseudo high levels of D. I have 2 slides to show you so you can understand it better. Excess of vitamin D can cause magnesium deficiency. Now, let me explain how this works. Now, why too much of D is not good besides every other reason? When you have lots of D, you're going to absorb a lot of calcium. And once you have a lot of calcium inside your cell, then the reverse happens. You have more calcium inside the cell and magnesium. Number 2, you need more magnesium to drive the calcium outside the cell. So your body uses up more magnesium. So too much of vitamin D is not good. So this is the reason why generally I do not advise intramuscular vitamin D. People take 50,000, people sometimes take 500,000, 600,000, a million. My advice is not to do that. Because I'm of the opinion that you have to live with nature. You are supposed to live outside during the day, at least a part of the day where you can get sun exposure and make your vitamin D. And that there is a daily dose. So this is done on a daily basis. You can't put an intramuscular injection of 500,000 units and hope it lasts for 1 year. And there will be high levels, because the graph is going to go up and gradually come down. When it increases the vitamin D levels to very high levels or a sharp rise, you will become vitamin D deficient. Why? How do you recognize this? You see, this in one of the doctors in our chat group had COVID, and he was given just 25,000 IU vitamin D as an intramuscular injection, followed by 10,000 units, which is not excessive dose. Now he developed severe constipation, which was only relieved with magnesium. Okay. So what does it mean? Usually 25,000 doesn't cause deficiency, but in his case, it did. The reason would have been because he was already magnesium deficient and he just tipped the balance. So take vitamin D, which is very important for health and living. But my advice is take a recommended dose, a physiological dose on a regular basis rather than going for a very high dose of intramuscular vitamin D. High doses of D increases calcium levels and, as I mentioned, will decrease magnesium levels. So this is a patient, 59 years of age, and she was on 6,000 units of vitamin D, just 6,000. This is not a high dose, but when I repeated the vitamin D3, 25-hydroxy D, her level was 329. Now, above 350 for a prolonged period of time, you can fear toxicity. But at this level, you need not worry, but then you don't have to have such high levels. So this is what I call a pseudo high level, because 6,000 units should not increase to this level, because 100 units should increase only by 100 units should increase 2.5 IU, 2.5 nanomoles. So 6,000 cannot bring to 329 nanomoles. So what I did was I gave her magnesium supplementation. So this was before magnesium, and after magnesium, the level normalized to 130. So if you monitor someone with vitamin D, a standard dose increases vitamin D to much higher levels, then you can be sure that that person is vitamin D deficient. This is another patient who was on 14,000 IU. And even at 14,000 IU, I had my doubts that it will go to 246. So I gave her magnesium 500 milligrams BD, and it was reduced to 800, yet it went up to more than 250. So my advice was to increase the magnesium dose. And she is the type who will benefit from magnesium infusions, either as a Myers cocktail or magnesium with B vitamins on a regular basis, because that high dose of magnesium, I'm sure it will regulate the vitamin D levels. Okay, now coming to functions and signs of deficiencies. Some of these slides will be a repetition intentionally because you can remember and take note. As I mentioned, more than 800 enzymes need magnesium. Energy is ATP, as I mentioned, is only active if you have enough magnesium. ATP without magnesium is not active energy, and magnesium is a membrane stabilizer because it is important to stabilize the membranes so that you don't get excessive nerve activation and excessive muscle contraction. Remember, this excessive muscle contraction is your cramps. Excessive nerve activation could be your epilepsy or fits. Magnesium is very critical for protein synthesis. And remember, our body is made of so much of protein because protein is everywhere. You know, it's in your enzymes, it's in your hormones. Protein, you just keep making different types of proteins for different functions. And if you are deficient in magnesium, which means to say that even your enzymes, like your digestive enzymes, will not be sufficient. Cell signaling means the communication between cells. They talk to each other. They always talk to each other. And there are various ways cells communicate with each other and pass all the information, how one cell should activate the other cells and so on. This happens from head to toe all the time, even in your sleep. Cell signaling is very, very important. And this cell signaling depends on ATP. and ATP needs to be activated with magnesium, which goes to say one cell talking to another cell will be affected if you are magnesium deficient. So say, for example, in the brain, you receive a new information. And if you want to store it as memory, one cell, brain cell, has to talk to another brain cell to convert information to memory. So it won't happen, or it will be affected if you are deficient in magnesium. It is also important for electron transfer from donors to acceptors, because this is where how you regulate your free radicals. This is how your antioxidants work. And magnesium is extremely important for mitochondrial electron transport, because that is where you generate ATP. So magnesium is important in the generation of ATP. Magnesium is also important for ATP to function as energy molecule. This is one reason why when you are magnesium deficient, the typical sign is lethargy, lack of energy. Magnesium is very important for nerve conduction and also healthy muscle function. I mentioned that muscle weakness, the important reasons are magnesium and vitamin D, as well as testosterone. So this is a very common problem in aging people. So they have weakness in the muscle. They are not able to lift weights. They are not able to exercise. And that leads to increased fall and fractures. It maintains healthy RNA and DNA. Why it's important? Because unhealthy DNA can become mutated DNAs, which increases the risk of cancer. There are many enzymes. I just wanted to mention a few of them, but they are all, tongue-twisting medical words. Don't worry about so much about the terms. One is GTPase, and this is the signal transduction enzyme on the cell membranes. So this is important for your taste, smell, and perception. I'm just giving you an example. And perception of light. So if you are magnesium deficient, for example, as you age, you lose taste and smell. So you don't enjoy the food and you push yourself to undernourishment. You may not eat enough protein, so you don't form enzymes, you waste your muscle, you have osteoporosis and so on. So it's important for every aspect of life. And I mentioned that also it's important for protein synthesis. Very importantly, magnesium is important for differentiation of cell division, which means when your cell divides, it must be a controlled division. If it goes uncontrolled, then there could be excessive cell division, which is an initiation of cancer. So you want to control cancer, then you have to have adequate magnesium. Another enzyme is phospholipase C, which allows calcium to enter the cells. Another one is adenylate cyclase, the enzyme that controls ATP to cyclic AMP. Don't worry about all the names, just look at the last point. This cyclic AMP is another signal transduction enzyme for glucagon and adrenaline. Glucagon is the hormone which does opposite of insulin. Insulin brings down the sugar, and then glucagon, if once the sugar levels go to critically low level or lower than what is good for your health, glucagon will increase the blood sugar level to bring it to stabilize it. So if you are deficient in glucagon or you have a non-functional glucagon, then you are likely to get hypoglycemia, low blood sugar. And adrenaline hormone, it is the fight or flight hormones, which is necessary for you to handle acute stress. So these hormones themselves need magnesium. There are more enzymes. One of that is one that converts GTP to cyclic GMP, important for calcium to enter the cells, peptide hormones to enter the cells. So what needs to enter the cells itself needs enzymes, and those enzymes need magnesium. And they also regulate ion channels. And this is critical for sodium and potassium transport. So if you become magnesium deficient, you are likely to be potassium deficient as well. This is why I like to combine the two. And you have seen in the previous slide that potassium deficiency increases magnesium loss. So the two go hand in hand. One deficiency aggravates a deficiency of the other. Now, the signs of magnesium deficiency, as I mentioned, fatigue because from ATP, okay? Muscle spasm and cramping. Please remember, if you have cramps or spasms, look for magnesium deficiency. You can safely supplement yourself with magnesium because it's not toxic and assess your improvement. Constipation is a very common sign besides low thyroid hormone and candidiasis. So is irritable bowel syndrome, digestive disorders. Magnesium deficiency slows everything just like low thyroid hormone. You can have bradycardia. Remember, if you have bradycardia, you don't immediately need a pacemaker. Look for other causes. And you can also have arrhythmias, which means irregular heartbeat. And one of the reasons is magnesium deficiency. The other is potassium deficiency. And I mentioned that both coexist. So you don't need anti-arrhythmic drugs. You don't immediately need a pacemaker. If you have low heart rate, then look for low thyroid hormones, low magnesium levels. If you have irregular heart rate, you look at magnesium deficiency, you look at potassium deficiency. Other signs, numbness and tingling. Hypothyroidism also causes this. Mood and behavioral disorders, especially depression. Osteopenia, that means thinning of the bones, and osteoporosis is more extensive bone loss. Stiff joints, stiff muscles, and ligaments. So when you wake up in the morning, just like hypothyroidism, you feel stiff all over. Atherosclerosis with calcium depositions. So if you do not recognize these, then you will have unnecessary procedures done. It is okay as an emergency treatment, but if you do not address the deficiencies, then it's just going to come back. You put in a stent, 4 to 5 years later, you come back with the block. The reason is because you are not treating the cause. Arterial calcification means calcification outside the bone, which is again magnesium, K, and D deficiencies. Magnesium deficiency can cause high blood pressure, chest pain, and heart attacks. Alzheimer's disease, arthritis, asthma, anything that there is magnesium deficiency, there is stiffness, just like your air passage. Bruxism or grinding of the teeth during your sleep. Magnesium deficiency is a common cause for migraines and headaches, poor cognition, and poor sleep. So if you start magnesium supplementation once a day, you may want to take it at night to enjoy better sleep. You can have palpitations, you can have panic attacks because of anxiety, you can have dysmenorrhea or painful menses, acid reflux, adrenal fatigue. Now, chronic stress, which most of us are subjected to, willingly and unwillingly, increases adrenaline, noradrenaline, and cortisol. All these hormones, when they are in excess, they deplete magnesium. And magnesium is very important for adrenal function. So the hormones deplete magnesium. Magnesium deficiency again disturbs the adrenal function. So magnesium, how it helps in hypertension is it actually relieves the spasm. So it relaxes the blood vessels, reduces, as I mentioned, the intracellular calcium, which is very common because your blood vessel wall is also made of cells, and magnesium acts as an antioxidant. As far as heart disease is concerned, it's more of energy and magnesium. So magnesium becomes your essence of life. Left ventricle, or the left chamber of the heart, ventricle pumps the blood out of the heart, has a high magnesium concentration. Now, for those, we call the cardiologists who practice integrative medicine or integrative cardiologists as intervention cardiologists. So if you are lucky enough to have a cardiologist attending you during a myocardial infarction or heart attack, what they'll do is to give you a slow intravenous magnesium. Why it is important is because it reduces arrhythmias. One problem with myocardial infarction is irregular heart rate. So it reduces that and increases blood flow. So it's a very important treatment. But because it is not recognized, because it is not accepted, and so it is not used very often. Cardiologists will tell you to stop all the supplements. I have a very close friend of mine who underwent what do you call stenting for blocked vessels. Of course, it cost him 80,000 ringgit. So it's not cheap anymore. But if you are ventilated from COVID, then it could cost you up to even 300,000 ringgit. A patient of mine's father was admitted after vaccination, apparently, and he stayed for a month ventilated and he died, and the bill came to 300,000 ringgit. So this friend of mine spent 80,000 ringgit, and he has extensive atherosclerosis, and he was advised to stop all the supplements, which is actually very sad. Very sad. One doctor just called me before the webinar. One of his patients went to a nephrologist, and again, this patient had improved. Her pre-diabetes was reversed. LDL came down, her triglycerides had come down, and she feels better, she feels good. But her nephrologist told her to stop all supplements because she has one kidney and the other kidney was donated to her husband. So this is the advice, which is very sad, because you just take away everything that is going to benefit your organs. So whether it is the heart, it is the kidney. So remember, magnesium is an essence for your life. So you can have increased heart diseases, you can have heart attack, heart failure, fibrillation. They are all associated with magnesium deficiency. Magnesium deficiency can increase cholesterol levels because it works the same way as statins to reduce your HMG-CoA, which actually reduce cholesterol synthesis. So instead of using a statin to do the job, you might as well take magnesium and even niacin or vitamin B3 to do that. They are natural without side effects. Magnesium can also reduce your low density lipoproteins and triglycerides and increase HDL. No statins or cholesterol lowering drugs increase HDL. It can convert omega-3 and 6 into prostaglandins. Another way it helps heart disease, and in fact, a lot of other problems is by managing homocysteine levels. Homocysteine is an amino acid. When it's more than 9, the level shouldn't be more than 9 in your body. This is like insulin. It can cause A to Z disease. So homocysteine metabolism needs magnesium. So somebody who has high homocysteine needs B vitamins as well as magnesium. Another reason I mentioned to you about high protein diet, another reason why high protein diet is not advisable on a regular basis is because it increases homocysteine levels and that depletes your magnesium. So remember, homocysteine should be routinely checked. If it is high, the solution is to cut back on protein and supplement yourself with vitamin B and magnesium. Magnesium is also associated with magnesium deficiency can be associated with high CRP and uric acid. CRP or C-reactive protein is an inflammatory marker. I mentioned this during candidiasis talk because magnesium acts as an anti-inflammatory agent. So whenever there is inflammation, magnesium is used and that level gets depleted. High uric acid also causes inflammation, and magnesium will also be useful. I mentioned I had a case. I presented the case during the Candida talk, where high uric acid. I showed you the proof that is caused by high insulin levels, and when you control insulin levels, it definitely improves uric acid. But remember to supplement with magnesium as well. Magnesium is a wonderful mineral for managing diabetes because it is necessary for both the synthesis and secretion of your insulin, and it facilitates your carbohydrate metabolism. Magnesium is also important for many steps of the glucose metabolism. It improves glycolysis, which is breaking down of glucose for energy, and it actually activates the enzyme called tyrosine kinase, which allows glucose to enter your cells. So if you are magnesium deficient, you worsen your risk of diabetes. You also worsen your risk of diabetic complications. Why? Because magnesium can help reduce your blood sugar. It improves your insulin sensitivity, regulates your obesity genes. It actually reduces inflammation and insulin resistance and reduces the complications of diabetes. So one mineral with hundreds of functions. Magnesium and cancer reduces cancer risk by many mechanisms. Some of the main mechanisms would be by reducing inflammation and by reducing insulin resistance and reducing blood sugar, because cancer lives on sugar. Cancer is present in the presence of inflammation and insulin resistance. And the way actually magnesium helps in cancer prevention and treatment is because it stabilizes DNA expression and improves mitochondrial health. I don't have time to go through these. If time permits, maybe we can look at mitochondria as one of the webinar lectures. Now, mitochondria could be the seat of cancer initiation. So a dysfunctional mitochondria could be a starting point for cancer cells to form. So anything that improves mitochondrial health improves overall health. It balances blood sugar, stabilizes cortisol, which is the anti-stress hormone. GABA is the calming neurotransmitter, reduces inflammation and improves depression. This is how magnesium is so useful to manage stress and anxiety. So if someone is depressed, instead of running for antidepressants, someone is anxious, instead of running to anti-anxiety pills, might as well consider how magnesium manage the cortisol levels, and you can safely supplement yourself with GABA. Magnesium is very necessary for sleep because it helps in melatonin synthesis. It decreases the sleep latency. That means you are able to get into sleep faster, and it increases both the quality of sleep and the total sleep time. That's why if you are taking once a day, you might as well take it at night. Inhibits glutamate, which is an excitatory neurotransmitter. and increases GABA, which is a calming neurotransmitter. This is how it balances, improves cortisol balance, because if your cortisol is not balanced, you will lose sleep. It helps in headaches because it interrupts the deficiency, interrupts melatonin synthesis. If you can't sleep well, you end up with a headache, and it relieves muscle tension and spasms, especially the temporal headache, and magnesium acts as a relaxant. Inflammation is something that all of you all need to understand, because chronic silent inflammation, silent, it's a smoke. That is the underlying cause of almost all known diseases. And calcium is pro-inflammatory. Magnesium is anti-inflammatory. Another slide to remember, so that you do not routinely supplement yourself with calcium. Musculoskeletal problems with magnesium deficiency, you can get cramps, fibrositis. Now, some patients are diagnosed with fasciitis. That means they have a lot of pain on the palms and the sole, and the diagnosis will be inflamed fascia. And there are lots of treatments given, but none of them work. In my experience, controlling candida, I've treated 2 patients recently, one with palmar fasciitis, the other is plantar fasciitis. Palmar fasciitis is so much painful that they cannot even grip. Plantar fasciitis is so painful, especially in the morning, they can't put their feet down. And I treated them with magnesium, of course, with other supplements, and candida, because they had the symptoms. One patient had symptoms, the other patient is my suspicion. Both of them improved significantly. Magnesium deficiency is also involved in fibromyalgia, a lot of muscle pain and tender points, spasms in the gut, migraines, chronic neck and back pain, and tense jaws, as well as bruxism. So how does magnesium help in fibromyalgia, which is a very common diagnosis nowadays, because you have a lot of tender points. Reduces muscle stiffness, it reduces muscle inflammation and pain, relieves your palmar and plantar fasciitis. It improves sleep, which is a problem in fibromyalgia, and it also improves anxiety and depression. So this is one of the treatment for fibromyalgia. It is also very useful in chronic fatigue syndrome. Fatigue means energy, energy means magnesium, magnesium means ATP. Okay, but of course, chronic fatigue syndrome, there could be many other causes. I almost always find an association with candidiasis. Calcium excess and magnesium deficiency can cause mitochondrial dysfunction. Again, mitochondria means energy. Energy needs magnesium. TMJ is temporomandibular joint, your jaw joints, and a lot of patients have this pain. Okay, and the causes can be inflammation due to excessive grinding of teeth and chewing, excessive chewing, misalignment of teeth and jaw, again a gluten problem, and stress. All these are aggravated by magnesium deficiency. So if somebody has TMJ syndrome, part of your treatment should be magnesium supplementation. Magnesium is associated with mental illness like sleep problems. You can have apathy and compulsions, especially irritability, anxiety, and depression, poor IQ, very common in autistic children and ADHD children, very common in epilepsy, Parkinson's, and Alzheimer's, and very common in bipolar disorders. It is needed for the synthesis of serotonin, which is a happy hormone. So depression is associated with magnesium deficiency. Dopamine is a neurotransmitter that actually gives you a sense of reward and pleasure. So if you do something that is good, appreciated, then you feel good. Whereas if you are dopamine deficient, you lose interest in life and You don't feel the pleasure of doing things which actually makes you and makes others happy. And so people end up in a lot of addictive behaviors, drug addictions, and criminal behaviors. Magnesium is very, very important for detoxification. The more toxic you are, the more likelihood of magnesium deficiency existing in your body. Very important for detoxification of magnesium, lead, and aluminum. Pb means lead, Al means aluminum, Hc is for mercury. It is very important for you to make your glutathione, which is the master molecule, is one of my favorite topic. The cofactor in functions of enzyme P40, 450 enzyme system, because these are the detoxification enzyme systems that are involved in the detoxification of many things, including the drugs. Magnesium is also important for digestion because it is involved in the secretion of hydrochloric acid. And it is important for healthy kidney function. Deficiency is associated, as I mentioned, with atherosclerosis of renal vessels, and it worsens blood sugar, which is a big problem. Diabetic patients have a lot of kidney problems. Magnesium supplementation prevents and treats kidney stones, especially when combined with vitamin D, K, and B6. And it reduces excess calcium. Magnesium is deficiency is associated with nerve problems. You can have burning pain, pins and needles. So you should also look at vitamin B deficiency and hypothyroidism here. You can have numbness and paralysis, twitching and tingling. Twitching of muscles is also a sign of potassium deficiency. Epilepsy and vertigo are common in magnesium deficiency. Parkinson's disease, you have to think of magnesium because magnesium is required for dopamine synthesis. Dopamine is what is deficient in Parkinson's patients. The usual treatment is L-Dopa, which is a drug, and it has got side effects. Raynaud's syndrome is a circulatory problem, especially in the legs, where you have painful episodes, very painful because of poor circulation. No specific conventional treatment can be helped with magnesium and chelation. Useful in sports injuries and recovery because exercise, actually you tend to have some lactic acid. Magnesium helps your body to remove the lactic acid. So there is less post-exercise pain in the muscles, and you also have less muscular spasms. I always say this, why people collapse in the badminton court or football field and have a heart attack and die is probably or very likely because of magnesium deficiency. Any athlete, anybody who works in the hot sun and sweats a lot, likely to be magnesium deficient because you lose a lot of magnesium in sweating. In obstetrics, it's important to recognize because magnesium deficiency can cause premenstrual syndrome or painful menses. It can lead to premature contractions and premature deliveries. I've always managed premature deliveries with magnesium, without drugs. Preeclampsia and eclampsia, which is hypertension associated with pregnancies. Magnesium deficiency can increase the risk of cerebral palsy in the newborns. SIDS means sudden infant death syndrome or cot death. So it can be associated with magnesium deficiency. Male infertility. So magnesium, because it affects the sperm count and sperm qualities. So how do you recognize someone who's deficient? So this is a repetition, but it's good to go through. Someone who has high alcohol and coffee intake because of diuresis, you pass a lot of urine, you lose magnesium. If you have angina, anxiety, if you have arrhythmias, asthma, or if you have bowel constipations like diarrhea or IBS, if you suffer from chronic fatigue syndrome or fibromyalgia, if you have epilepsy, if you have difficulty in swallowing food or supplements, this is another symptom. The one that you should also remember is hypothyroidism. If somebody has depression or diabetes, and those who are on drugs to treat certain conditions, especially diuretics for hypertension, antibiotics and steroids, contraceptive pills, bronchodilators for asthma, PPIs for gastritis, and statins for cholesterol. So what happens when you use statins? It's reducing cholesterol, but increasing magnesium deficiency. So tell me how to protect your heart. Someone who eats a diet with low vegetable intake and high protein diet, someone who has food cravings for carbs, salt, chocolate, and junk food. Anybody with hypertension and palpitations, heart disease, headaches, hyperthyroidism, and hyperparathyroidism, somebody who has sleep problems, someone with kidney stones, or anybody who has mercury fillings. Okay, because a lot of magnesium will be used up for detoxifying the mercury. If you suffer from migraines or menstrual pains and cramps, and you realize the list is very long, those who are taking mineral supplements. Now, remember this, if you take calcium without magnesium, you are in trouble. It's better to take magnesium and not calcium. Taking zinc without magnesium, taking poor quality magnesium, or if you suffer from muscle cramps or twitching and weakness, if you have numbness and tingling in the hands and feet, if you suffer from osteoporosis, if you are pregnant, you could become magnesium deficient, especially if you have multiple and frequent pregnancies, if you have suffered hypertension in pregnancy, if you have suffered postnatal depression, or if you have a child with cerebral palsy. If you have ever undergone radiotherapy, if you have this painful circulatory problem called Raynaud's syndrome, if you drink water enriched with fluorine, calcium, and chlorine, unfortunately, most of us, this is the water we get unless you filter it. And deficiency will also be there if you have reduced intake from unhealthy foods only, poor soil quality, I'll tell you why, and from cooking where you lose magnesium. You can also be deficient if you have reduced absorption because of poor digestion. I mentioned to you about candidiasis. If you have low stomach acid, if you have IBS or leaky gut syndrome or chronic diarrhea. These are all the reasons why you become deficient. We looked at how to recognize deficiency and why somebody is that could become deficient. If you have also reduced absorption due to excessive iron intake or regular iron intake. Now, in my practice, I always tell my patients, 2 supplements that you do not take as a routine, iron and calcium. If you are on high protein diet, if you drink a lot of tea, if you have, you take the seeds, bran, or the grains, especially because the bran has phytic acid, will reduce the magnesium absorption. If you take a lot of soy, or if you take a lot of spinach and chard, I'm not sure whether I agree with this, because in my opinion, I don't think so. Natural food will cause problems unless you take anything in excess. If you need more magnesium to detox, especially acetaldehyde. For those who attended the Candida talk, I mentioned about acetaldehyde from yeast. So you need a lot of magnesium to detoxify the acetaldehyde. So if the more fungus, the more magnesium deficient you are, the more fungus you have. The more fungal overgrowth you have, the worse becomes your magnesium deficiency. So it becomes a vicious cycle. And if you have heavy metals and toxins, If you do moderate, excessive, or prolonged exercise with sweating, good to remember to supplement with magnesium. And if you are healing from infections, surgery, or trauma, just like vitamin C and D, if you have increased excretion, you could become deficient. So why do you have increased excretion? Sweating, diabetes because of a lot of urine output. If you are insulin deficient, because now for insulin synthesis and secretion, you need magnesium. Insulin is needed for magnesium and potassium to enter the cell. So this is why diabetic patients suffer a lot of complications. So diabetic patients with insulin resistance will be magnesium deficient despite taking magnesium. So they need a much higher dose and control the insulin resistance. If you use regular laxatives and if you do prolonged fasting. Increased excretion can be because of high carb diet. You need a lot of magnesium to reduce the intracellular oxidative stress. If you are on diuretics for hypertension, you might as well just take potassium, which is a natural diuretic. High alcohol and caffeine intake, carbonated drinks. Herbicides, pesticides have a big problem because they bind to the magnesium in the soil. So magnesium does not become available to the plants. And they also kill the worms and bacteria, which help the soil to become more fertile. And they also affect the processing and breaking down of soil minerals. So this is why the more herbicides and pesticides that are sprayed, the more deficient our vegetables become. If you have gluten and casein sensitivity, if you have parasites of fungus, because not only they affect the absorption of magnesium need to be utilized for detoxification of their toxic products. If you are on antacids and PPIs, as I've mentioned, because of acid rain, which deplete calcium and magnesium in the soil, and if the vegetables, fertilizers high only in phosphorus, potassium, and nitrogen are used, because high levels of phosphorus means low levels of magnesium. Fluoride and fluorine not only in water and toothpaste, so please avoid fluoridated toothpaste. Please avoid, because they bind to magnesium. Food processing and cooking also causes deficiency. These are some of the examples where when you refine wheat, you lose 80%, you polish the rice, you lose 83%, you production of starch from corn, you lose 97%. And when you extract white sugar from molasses, you lose 99%. So processing of food, you cause magnesium deficiency. So how do you investigate? You can do serum magnesium, but in my opinion, it's a waste of money. As I mentioned, magnesium level is only 1% in the blood. The rest of it is in your tissues. RBC magnesium is it's something that is easily available, though it's not very cheap, but it's more reliable, much more reliable than magnesium. You can also do a buccal cell magnesium, which is not very convenient. The best way to assess magnesium is in your mitochondria, which is not easy. It's the most reliable test, but not practical. Why? Because magnesium is highly concentrated in the mitochondria. So the useful or a test that is more practical and available would be red blood cell magnesium. No point in wasting the money in doing blood or serum magnesium. There are indirect signs where you tap your facial nerve and then you feel that spasm, or if you tie a BP cuff on the left elbow and leave it for 3 minutes and see whether you develop the cramps, and this could not be, you won't be able to differentiate from calcium, but these are indirect signs, not accurate. So how do you increase your magnesium levels? For vegetarians, it will be useful. Green leafy vegetables. And if you take whole grains like rye, amaranth, and quinoa, or if you consume nuts, seeds, and legumes, sea vegetables, and high quality mineral-rich salts. So these are natural sources of magnesium. But on the whole, in my experience, I believe it's good to remember all these things, but magnesium supplementation is still useful for most of us because of the demand we put on our body. So this is a slide where you can see some of some of the food that is with the level of magnesium. The best is scalp, then is wheat bran, wheat germ, almonds, cashews, molasses, Brazil nuts, lots of nuts, millet, rye. I'm not in favor of tofu too much. The treatment must be individualized because it's usually a 500 milligram capsule given once a day. But for most people with medical problems, they'll require twice a day. You reduce the dose if it causes diarrhea. But diarrhea doesn't mean that you're overdosing. It is because of poor absorption. And always remember to maintain at the upper end of the reference range, especially if you have got red blood cell magnesium levels, and please stop taking sugar. So what are the supplements? The best would be liposomal magnesium or ionic magnesium. Both are not easily available. The next choice would be to take magnesium as citrate, malate, glycinate, not so much oxide. Now, there's so much of importance given to this citrate, malate, and glycinate because they all have their individual functions. So citrate will have different benefits, malate have different benefits, and so is glycinate. But what is important is not so much of citrate, malate, or glycinate because the amount is small. What is important is whether you can get that magnesium into the cell. Okay, so you need a magnesium that is better absorbed. If you don't have liposomal or ionic magnesium, then it's better to go for a combination of citrate, malate, and glycinate. You can also use magnesium chloride, which is in a liquid form, magnesium as oil or lotions, magnesium as magnesium L-threonate, which has been shown to enter the blood-brain barrier better, so it's better for brain health. And you can also have Epsom salt baths, and which is very cheap. You just buy a packet of Epsom salt, fill the bath up with warm water, and just lie down for about 20 minutes. Magnesium is also available for intravenous use as magnesium sulfate. Usually it's 2.47 milligram per 5 ml. You require mostly just 1 ampule. If you are going to give magnesium as IV, then it has to be diluted and slow IV for over 5 to 10 minutes. You cannot give magnesium as IV push because the patient will suffer from acute hypotension, low blood pressure. Magnesium toxicity is something that you need not worry about, especially with the oral dose, because the level of absorption is controlled by blood levels, which means if you have enough, you absorb less. So if you continue to take magnesium and at some point you get diarrhea, maybe you can reduce the dose. There are few contraindications which you will hardly come across. One is myasthenia gravis. They have severe weaknesses in their muscles, but unfortunately you can't use magnesium to improve the energy levels because magnesium will cause relaxation. It could worsen. You may want to try a small dose and see whether you feel better or worse. if you have very severe low heart rate or bradycardia, if you have severe bowel obstruction, or if you are in end-stage kidney failure. I would suggest end-stage kidney failure, you can still check your RBC magnesium and decide whether you need it or not. So once bradycardia is treated, once bowel obstruction is treated, then you should put them on magnesium. I want to share a case with you. Of course, this girl, I gave her magnesium as well. Now, this is a 15-year-old girl. She was diagnosed with diabetes very recently, and her blood sugar was around 28, random blood sugar, very high. And she was given 20 units of insulin 3 times a day. So my advice was, the diagnosis was pancreatic not pancreatic insufficiency, poor pancreatic function, or juvenile diabetes. I thought it doesn't really fit into that definition. So I checked insulin level, and I also checked her vitamin D3 levels, and I put her on supplements. And it took me many consultations to convince her grandmother, who was cooking for her, to change the diet. And finally, when they did it right, now she's only taking 7 to 8 units twice a day, and she's still taking the supplements. And these are the results. In June, on the 29th of June, her insulin level was 5.8. Now the healthy level, the healthy level should be 5.7. So usually when you look at 5.8, everybody is happy, but unfortunately, this is not the case, because with that high level of sugar, the insulin level should be much higher if the pancreas is functioning well. So this means is pancreatic insufficiency. It's severe pancreatic insufficiency, probably from chronic overeating of carbohydrates and high blood sugar. So when she changed her diet and repeat blood sugar on the 7th of September, the insulin level is getting better. It's 9.2, which means there is healing of her pancreas. Her HbA1c from 13.9, now it is 7.0. Ideal should be less than 5. Her vitamin D3 was 34. It's almost deficient state. And I put her on 10,000 units per day. Now it's 104. So I've advised her to reduce to 5,000 units and maintain. So what I'm saying is, even pancreatic insufficiency or diabetes, there's so much of improvement you can make, provided you understand the root cause of the disease. Okay, I thought I'll give you, every lecture, I'll give you a health pearl, not the original pearl, of course. You all can give me an original pearl. So today I'll talk to you about aging without becoming elderly. Now, biggest problem is, as we age, we lose the vitality. So we become elderly because we become dysfunctional. We are not able to carry out our daily routines. We are not able to exercise. We lose happiness. Many things changes. It doesn't have to be that way. The best way to live and age is to be like Galapagos tortoise. Have you heard about that? The huge ones that live up to 150 years and 200 years. And apparently, there is no aging in them. That means until their last day, they are still active and they are still fertile. They still maintain their reproductive capacity, even at that 150 years of age. We don't understand why They enjoy this God's gift, but we all age and we all will die. That is inevitable. We are mortal beings. But the idea is to live and age without aging, which means you maintain your vitality even at older age. One of the important thing that you must pay attention to is your mitochondrial health. Mitochondria is one organelle or one unit in your cell. Every cell has hundreds of mitochondria, and they are critical for your energy production. I mentioned this as ATP, and this every cell function in the body, your brain, how you remember, you think, and your heart beating to circulate the blood, and your muscle functions, your immune system, your digestion, everything depends on health. The moment you lose energy, there is cellular dysfunction. Then when there is cellular dysfunction, you do not only suffer from premature aging or accelerated aging, you suffer a lot of diseases or increased risk of diseases. You also suffer from increased risk of cancers. Everything just starts to rust and fall apart because of mitochondrial dysfunction. So mitochondria, if you want to keep mitochondria healthy, of course, there are supplements, but diet is very important. Carbohydrates are burnt for energy and they release free radicals. So a low carbohydrate diet eaten as an intermittent diet probably is a better way of eating rather than what you call a prolonged keto diet, which is high in protein, or prolonged fasting. Those are not necessary. You can do regular fasting, which is very important, and you must feel hunger. If you do not experience hunger, your mitochondria will not be healthy. Because the way the body heals and regenerates and repair is when you sleep early, when your stomach is empty during sleep. This is why intermittent fasting becomes useful and a very, very strong tip for healthy aging. So you must eat a low carb diet, and you may want to do keto diet for a short period of time, like a month. Unless you are very obese, you have diabetes, you can do it for a bit longer. If you have cancer, you need to do it longer still. But the diet is very important. Sugar destroys your health. Antioxidants are absolutely important. Vitamin C, glutathione is important. There is a supplement called alpha lipoic acid, which is very important as well. Resveratrol is very important for mitochondrial health, and so is magnesium and vitamin D. Regular fasting, if you can do fasting once a week, water fasting for 24 hours, that would be important. And you must feel hungry. Your body starts to go into the starvation mode where it starts to repair rather than building. So that is important for slowing down aging. And exercise. There are many exercises that improves mitochondrial health. Basically, when you exercise, you become hypoxic. That short hypoxia or low oxygen status is important to regenerate mitochondria. But the exercises that are specific for mitochondrial health would be aerobic exercise, weight bearing, and HIIT, high intensity interval training, which is like sprinting, and breathing techniques. Oxygen is vital, without which we will not be able to live, but it is bad news for mitochondria. Food is essential for living, but it could be bad for mitochondria. So you must know what type of food to eat. The way to reduce the damage of oxygen is to learn breathing techniques like the one I taught, slow and controlled breathing. So you reduce the number of breaths per minute, and you can practice several times a day you definitely will improve mitochondrial health. Exercise is important. Now I'll show you what you can do to maintain good health. And if you want to practice HIIT, this is what I do. This is where I go for hiking. This is at 2.2 kilometers. This is uphill. So once you have hiked, you may want to rest. You can do it on the treadmill and you need to sprint. And you do this a few times. This improves mitochondrial health. And the ones at the back are my 3 angels. Okay, thank you very much. So we can have some questions, Yamuna.
Yeah, Datuk.
We have about 20 minutes.
Yes, about that. Okay, Datuk, from Silvana, can we give magnesium for patient with myasthenia gravis? If yes, what type of magnesium we should address?
I just mentioned that as one of the contraindications. It's a double-edged sword because myasthenia gravis means loss of cellular energy, in which case magnesium is necessary. But magnesium, because it's a relaxant, then it just worsens the situation. So the better way to do, maybe you want to check the red blood cell magnesium and assess the level first. If it is low, maybe you can start with 250 milligrams of magnesium, which is a combination of citrate, malate, glycinate, and assess the progress. If it improves, maintain and slowly try a higher dose or 250 milligram twice a day. If it worsens, then you reduce. Oh no, sorry, you stop. So better to check the red blood cell magnesium levels first.
From Dr. Kiran, Datuk, does high phosphorus level increases parathyroid hormone level?
Because it actually affects magnesium levels. Magnesium levels affect calcium levels. When calcium levels are low, then it will stimulate your parathyroid hormone to produce more parathyroid hormones. So hyperparathyroidism could be a sign of magnesium deficiency. And so phosphorus is connected here.
And he also asked how much of magnesium is needed in an apparently healthy individual, the starting maintenance and the maintenance.
Okay, a minimum of 500 milligrams daily. If one has medical problems, if you are exercising regularly, if you sweat, then my advice is to take at least 500 milligrams twice a day. And I have always been on magnesium for many years. And I wanted to test myself because I wanted to individualize my dosage. I wanted to know how much does it take to cause diarrhea. Of course, I left the magnesium red blood cells magnesium aside. I just wanted to assess clinically. I needed to take 6 capsules of 500 milligrams. That means 3,000 milligrams to get diarrhea. Depends on what your body's needs are. Myself, because I sweat a lot from exercise and sitting in the sauna. Maybe because that's the reason why I need more. So I cut back to my regular dose is about 1,500 to 2,000 milligrams a day. Generally, it's about 1,500.
Datuk, he also asked what are the cocktail that you would advise for post-MI patients and when would be the best time to start? Can the cocktail for post-MI patients be combined with antiplatelets?
When you say cocktail, I would strongly suggest vitamin C because it's a healing agent and it's an antioxidant. You need to combine it with glutathione because it actually promotes a lot of functions in the body besides boosting your immune system and helping vitamin C. You definitely need vitamin D. Deficiency is associated with heart disease, and so is magnesium. Okay, this would be some of the basic supplements that you want to require. You require along with Q10. Now, when can you start? I don't see any reason why we should withhold at any time. If somebody is suffering, that's because they are already deficient. No, you don't have to wait, although cardiologists don't agree to this. What was the second question, Yamuna?
He asked if can it be combined with antiplatelets?
Okay, so antiplatelets, there's a problem. Some of the antiplatelets cause osteoporosis on the long term. If you want to use antiplatelets, I tell my patients, okay, it's not easy for me to give you a yes or no answer because you need to monitor your blood test. So what I advise is you supplement